I've had type 1 juvenile diabetes for 28 years, and I've been on the insulin pump for the past 12 years. When I was taking the injections, it was very difficult for me to control my blood sugar. Your life is much more structured when you're on injections, and the amount of food that you eat is based on the insulin that you took earlier in the day or right before you ate, and it's just much more difficult to have more freedom. Whereas on the insulin pump, you're constantly taking short-acting insulin. So if one day I want to eat no breakfast, I really don't have to because I haven't taken insulin prior that's going to affect me at that time. On the pump, you do need to change your injection site every 2 to 3 days. Based on, sometimes I have to change it every 2 days if I've eaten a lot or haven't exercised as much, or I could change it every 3 days. Now I'm going to change the insulin pump. The first thing you need to do is rewind the pump. And as it's rewinding, I'm going to fill the syringe with the insulin. I fill it with about 2 to 3 days worth of insulin. You need to make sure all the air bubbles get out. Then you need to attach the syringe to the tubing and insert it into the pump. And normally I would insert the catheter into my stomach or my back, but for demonstration purposes I'm going to use my leg. Clean the area, and you just press the button. It's inserted. Tape it on. I usually put a loop in the tubing, so just in case it gets pulled, the loop gets pulled as opposed to the catheter itself. It stays in. And that's it. And then you give yourself some insulin. 2 years after going on the pump, I had my first beautiful child. As far as controlling my diabetes throughout my pregnancy, the insulin pump was a lifesaver. I would test my sugar often, and I actually had tighter control during both of my pregnancies than I've ever had in my life, and it really helped, and I know that it contributed to my husband and I having 2 beautiful, healthy children.